Sasa katika mbio zikiwa ni bure kabisa. Kumbuka kuna malipo yote. Mtongo Bandari. Kumbuka kuchunga hii. Ukielezwa kwa moja. Ukiwa na nini Kenya. Ukiwa na kati Kaunti. Na mambo yanakuwa ni safi. Sasa
Hello. Nimetumana. Nafaa lete hapa. Basi wacha niweke alafu nione sasa kwanza. Angalia gari Elvis bwana. Hapa kuna jam na itapita. Haya, mwambie ingia hapa atalia. Gari. Angalia gari bwana.
All staffs wanahitajika nje.
Haya, hapa tu.
Ingieni basi. Basi iko nje. Maisha ingieni sasa. Basi iko nje please. Watu wangu wa road show mtukae. Ni hivyo tumemaliza kutoka huku ndani au watu wametoka huku ndani.
Sasa hapa ndio inaweza pale, sababu ndio akiingia tusimtoke na nyuma.
mtaketi mpaka penye nimekuta na wao.
Apa nje?
Hello. Mzuri? Panaitwa AHF. AHF hapo Mathare. Panaitwa AHF. AHF. Yes. Unaona ukishuka tu na njia ya mlango ushuke tu straight. Utapata mahali kuna event hapo. Kwa barabara tu kwa ofisi inaitwa AHF. Ushuke tu straight nikame. Bwana nikutumie pin ama? So sita haina shida. Sawa. Hello. HDMI.
Already they've already started writing. We need a team to come and support us.
It's better.
Yeah.
Inside the building. Yes. Okay.
So what they want to focus on the next remaining 3 years of the program is while they are trying to function the government.
Just what I find like a check again. Because you know, the moment you say that we're giving back, we're giving this feeling back to Gaba, you know what will happen. Yeah. So the question we ask ourselves, will we be able to say no to the government? Because even as your budget, you can't expand as much.
Hello.
Yes.
Go andika kwa phone niambie.
Eh?
Niambie. Videographer ashabaki, mtu wa nini ashakuja huko. Okay, that's all.
And infrastructure well
facility just right there, and he's going to guide you how you're going to do it. So thank you very much. We really appreciate you sparing time to come. This facility serves HIV-related illnesses. Besides that, we also provide cancer, STI, family planning. We also do some. We also doing lab work to ensure that not only giving treatment, just symptomatic treatment, but we also making sure the diagnosis is right. We've been working very, very closely with the departments from the ministry, even as the correct directions.
Excuse me, Simneza, let her move a bit on this side. Yeah. Camera tu.
So,
My name is Valencia. Our chief guest, welcome to AHF.
I can open this facility for you.
yes, Sana, 1 more. Yes. So, We have just the next step is that the team that was handling the renovations and building, we wish to hand over the key to AHF so that we can hand it over now, finally, to the new
Mr. Mats, you have been given the key.
Thank you very much.
I'll open it for you.
Thank you. I have the key, but it's not yet open.
So with the key now, I can open for him.
Yes.
All right, and we have to appreciate. So as a PS opens the play, of course we have to appreciate kupigia makofi jamani. Wonderful facility. Asante sana.
All right, it says, can I read for you?
Yes.
AHF, Kenya Malaria Clinic. This facility is funded by AIDS Healthcare Foundation, that is AHF Kenya. And it was officially opened on the 24th November 2023 by me.
Makofi tafadhali.
Give a coffee dinner. Yes. So I can now open it for you. So we can now declare this AHF building officially open.
Makofi tena jameni, makofi tushangilie. Kwa shangwe the official opening of the facility. Karibu sana wana PS. Karibu right here. The mic here. So, director here is going to guide you on what will happen. We are going to open the curtains. There is a mission complete and then we have to
So, we are very, as an organization, we are client-centered. Client-centered. No people can work on a journey unless they agree. So we have an agreement here, right here, between ourselves and the clients. That's what we request you to unveil for us.
All right.
Then we will sign it, both ourselves and the clients, in your presence.
So I can hold it officially like this, hold the other side. Hold the other side.
Come help.
Makofi kwa wala.
This is our promise. Provide to support, educate, guide, to provide care and treatment to help you attain health and wellness needs. So this is our promise to the clients. I'll let the provider here, Dr. Eunice, read what she promises on behalf of the NHS staff.
Yes,
Dr. Eunice,
so thank you, Bwana PS, for the time you have found to come launch this with us. So, as the healthcare workers of AHF Kenya, we are making a promise. As the
It's not working. It's not working. Continue. Yes.
As the AHF healthcare workers, supported by AHF Foundation, today we want to promise that to our clients, who you will meet today, that we will support them, we will educate them, we will guide them on their health journey, we will provide care and treatment and help them attain their wellness goal. So we will do that through serving them with respect, ensuring confidentiality, involving them in their decision making, advising them on the available prevention and care options. We will register them in the most convenient site, not necessarily this site, And also, we will give them the current information so that they're able to take care of themselves. Thank you.
Thank you very much. And one of our clients here, on behalf of the other clients, that are trained.
Good.
Yes.
Yes.
My name is Beldina Atieno. I'm a teacher by profession. Currently the deputy head teacher New Pumwani Primary, and I'm a client of AHF. I'm HIV positive and I've lived with the virus for the last 23 years. Now AHF came into our lives some 15 years ago, and from the time they came, life has not been the same. It has really changed. AHF gave us back our life, our health, and some of us even our job, because we were actually losing our job because of the virus. But from the time they came, they have really given us the full support that we need, the medication, the courage, the work, and we are good to go with the virus. So, as a client, I promise to keep clinic appointments, because without adherence, that's where we are losing them. Yeah, I also promise to provide full information related to my health, because we have doctors who have full confidentiality. So when we go there, we open up and we are assisted. I also promise to maintain a positive mental attitude and seek to help other clients. There are clients who are just knowing their status, and for those of us who are already strong in the virus, we put them down and we tell them that testing HIV positive is not a death penalty. It's simply a new start in life, and we encourage them. I promise to fully participate in my care and treatment process. For example, the support groups. These support groups are very, very important, because HIV on its own is a big mountain. But when you go to those support groups and you meet different people and you hear their stories, then you realize yours is not a big deal. Finally, I promise to be respectful to other clients and healthcare providers and maintain confidentiality. That is where it matters most. My main aim is to give courage and support. Thank you very much. So on that note, for the powers conferred to me with the virus and AHF, I want to sign here as a commitment on behalf of all the clients of AHF. Thank you. Thank you.
On the same note, I will represent all the service healthcare providers of AHF and this county, and I will also put my signature.
To affirm that, as the director of AIDS Care Foundation in Kenya, I also signed. And for the county,
we moved to Nairobi.
Signed on behalf of women.
Yes.
Today, 24th November 2020.
Well done. Yes, a commitment.
Yes, this is
Commitment has been made, so adherence, just sign the business. Yeah.
All right.
Then we'll go up and brief you further about the facility.
All right.
Wait, please. Thank you.
So this facility downstairs was the activities that patients were working with and taking medication and going away. As they were clients. But upstairs, we need to receive the doctor. We also need lab services, the pharmacy is downstairs, all the other services downstairs. And that is this way to the board, even have the treatment on the other side. Yes, the big space. Yes. So I pray that journalists you can stand here on this side, please. All right.
Pastor, the right you're supposed to be. Every pastor that is supposed to. Just cameras for 1 minute, while you are demanding what's our picture. Alright, so Bona PS is the team. So we're going to do a brief. There will be a video playing there also, but Karanja will take you through the facility and the briefing about this. Then from here, we're just going to do now the tour, how the patient will come all the way to Makamusha, and then we'll be done with the facility. Thank you very
much. NSCC and Masha and NASCO for the support that is given us. Because without them and the guidelines that we provide, it is possible for us to deliver care, also cooperate in this country. We also want to thank the government for allowing us to cooperate with this country more than 13 years. Also very 15 years, because when AHS started back in 2008, it started in Mombasa, and then it came to Nairobi, and then now it has spread to other counties in Mombasa, Mombasa, Kwale, and then then we have the Western totally, we are now supporting over 100,000 patients for treatment. To support this expanding program, we have now 287 staff employed, in addition to providing the service for testing and counseling, we also are involved in the care of treatment. But also, more importantly, what we call, and I refer to Dr. Masha's statement, closing the taps. Because for this, we must take care of the patients who are sick. We must be able to prevent more getting infected. So closing the taps. We're focusing on the triple threat, the issue of new infections, the teenage pregnancy, and also the issues of STD. Those are activities that we are doing. For the prevention, especially for young girls, we have a program that's called the Girls Act, which is a mentorship program. At time we give more details. And for that reason, even under here, we have a room for the youth, adolescent, and young people. In addition to that, we are able to invite you to launch the Boys to Men program. Because we felt that the ladies, the fair gender, has been overfunded. The boy child is getting lost. So for this reason, we want to join in the Boys to Men, and we have seen a lot of support and commitment, even from the ladies, about the boy child. Because finally, all of us are children of a child of a woman. Yes. So our mother's care. So that's one the other issue. The other thing, we also support the county government and the national government, but mainly the county government where we operate is also improving the facilities. Like the renovations we've done here, we've done similar renovations, smaller facility for the county, planning to do another one. Otaita will build a new 8-room CCC clinic will launch on the 1st of the Children's Hospital itself. Next year, God willing, we'll do a 7-room facility to also improve the working environment for staff. When you post staff in this facility, they work together with the county. We have a couple of challenges, maybe I mentioned here, and one of them are comfortable to pay the taxes, bringing in condoms that they are going to donate, and your office will be able to help us in one way or another. In addition to this facility is big. I can see my team called it a clinic, but this facility is bigger than a clinic. It's a medical facility because it's full-fledged. I know even where we are coming from, the smaller facility, Dr. Eunice has actually delivered babies there. Because when they come in that stage, there's no time to move the mother. They're able to, they have the skills, they're able to deliver. So the PMTCT is actually set such that they can deliver the mother. Because the same setup we use for cervical cancer counseling is the same method that we use to deliver the mother. So it's already set up for emergencies, for dealing with reproductive health in full, and in particular STIs, given where we are and given the status where we are. So that's a major issue. So for this facility, we wish we could have a gene expert because of the issues of TB. Because TB and HIV are really interlinked. For that reason, we could get a gene expert who could help Nairobi, decongest the other facility in Nairobi, given the sufficient space, so that we keep bringing in machines to meet the needs of them. Yes. For this reason, I don't know whether Dr. Eunice wants to say one thing, because this is your facility.
Okay.
Yes.
So thank you. Thank you, sir, for your time, for coming here today. So maybe just a brief about AHF Mathare Clinic. It is that we started this clinic in 2013, November. So we are very happy that we are celebrating 10 years in style, because we are now moving from a smaller facility that was congested with a few challenges of the space, and now to a bigger facility where we can better serve this community. So our population is very diverse, actually, as much as we are right on Juja Road, facing Mathare slums. Most of our clientele come from Mathare slums, but we also have clients coming from as far as Kayole. So we cover basically the whole of Eastlands. We have Kayole, we have Kariobangi, Dandora, Korogocho, and behind here we have Shauri Moyo and Kiambio. So we have a large population that we serve, and for that reason we want to be unique, and that's why we feel this state-of-the-art facility will serve that community better. So the terms of services that we offer, as Dr. has said, we are a fully fledged clinic. I am a medical officer myself. We have clinical officers, nurses, laboratory technicians, pharmacists, HTS providers, those are the counselors. So we are a fully fledged health facility, registered under the laws of Kenya, and also abiding the ministry's acts and laws. So over that is that our services, we haven't limited ourselves. As much as we are AIDS Healthcare Foundation, we cannot limit ourselves to just offering HIV services. So what we have done, we look at the client holistically. So when the client comes in, yes, they'll have HIV. They may come in with TB, so we also offer CB services. They may be women of reproductive age who require maternal and child health services. they will get pregnant, so we will offer ANC, and once they deliver, we'll offer CWC for the children. So we immunize the babies right here on site. We follow them the same way they would have been followed up in a government facility. From there, we also cannot separate and also cannot ignore the fact that the same patient is likely to get NCDs. So we are grateful to AHF for providing us with free NCD drugs. So we are able to treat hypertension, we are able to treat diabetes, and we are able to also refer what we cannot treat. For the reproductive health, we've really expanded over those 10 years that we've been here. We've expanded to ensure that we are offering cervical cancer screening, and we are currently having plans to purchase a thermoablation machine so that once we diagnose the early cancers, then we can also be able to treat on site, and all our nurses have actually been trained to do that. For the youth, this clinic actually, among the AHF clinics, I think we have the largest youth population, because you can see where we are domiciled. So we have a youth population of about 300, 10 to 24-year-olds seeking services in this facility. So we have been engaging them over time in various activities. Even today you will have an opportunity to meet just a few of them. And because of the environment they are living in, they were facing all the challenges of the triple threats that Dr. has mentioned. And so to avoid that, we tried to engage them. And during the COVID year of 2020, we were actually able to register for them a CBO. So they are called Florix Youth Initiative, and they've been supporting NDCC in most of their activities. They have actually been leading peer-to-peer facilitation for HIV activities, and they have actually have a good platform to be able to seek services. Over and above that, for the TB patients, this clinic, we've actually even been treating multi-drug resistant TB clients because of our population. And just to mention, every week we collect 20 TB samples. So as we speak, we are in November, we looked at our records and we've actually investigated 958 TB cases. Out of that, unfortunately, 17.2 have been positive. 17.2% of the samples we have collected have been positive. So because of that, we have
this.
Karibu sana.
Asante sana.
Community again.
Apologies.
Karibu.
Thank you very much.
okay, so welcome.
Thank you.
So we're saying our TB positivity rate is actually very high from just the samples we collect in this facility alone, not in other facilities. So we have a positivity rate of 17.2% this year. And so that tells you that us referring samples, maybe we are not reaching the whole population. So as Dr. was requesting, we want to support that. If we can also be supported from the ministry, if you find it in your capacity to do our diagnosis, bacteriological diagnosis from this site, because we have the space and we have the staff capacity. We get a gene expert machine and we diagnose on site, then we feel we can be able maybe to reach a bigger population for that. On top of that, because of where we are living, we realized there is a vulnerable population, and these are the street families. So they used to come and seek services on and off from our facilities. And we realized occasionally they would come in very late. They either come in end-stage HIV or they are very sick with TB, pneumonia, and other diseases. So we started engaging them. So the moment we started engaging them, we realized they are coming in more and more and more to the facility. So you engage one, you know, there they live in what they call a base. So a base can be a corridor and then it's demarcated and 10 of them are living in there. So you realize if one gets TB, they are likely to infect the whole population. So unfortunately, there is just one across the road here next to Kiboro Primary School. And from that base, one time we diagnosed an MDR client from there. And when we invited now the other family and peers who live in the same base, we got 15 other positives from that side. And so we realized that population is disadvantaged. They do not know where to seek care. and so we opened our doors to them. With that, the population has grown. Now they came in with other challenges of where do they take a shower, where do they get a washroom, and such other challenges. So we from our old clinic, we put aside a room for them and a washroom. And the challenge now we have is the clothes to change, because we rely fully on donations from well-wishers and our staff mainly. So especially the men, they're really challenged, because women, you know, you can adjust waist here and there, a blouse, but the men now, if the trouser is really baggy, I mean, you really can't walk in it. So that's a big challenge for them. But we've embraced that community, and now we want to go wholly and just have a program for them, because they have other issues. They use drugs, they'll inject drugs, and they will get sick like any other member of the society. So we will show you this same building. We incorporated a space for them to continue getting the same services. But as you can see, this area you don't get really much space, so we will squeeze in there with them. So with those few remarks, that's the brief history of AHF in America.
So just karibu sana Mheshimiwa. Listening to the story here, Mheshimiwa, this team has done fantastic. We want to thank the management of AHF for the good work that they have done. They have given us the story. 13 or 15 years ago, where they were and where they are now. And we're very happy for what they've done. As a government, we are going to support you. We are going to send a team here to come and especially the ones of NASPO. We've said we're dealing with them already. The team should also come here and then assess facility and see how we can partner together. Government and AHF can partner in this area, because looking at the population that we are serving, it is a population that the government is trying to reach out. And if indeed you are going to be the bridge, then the role of the government is basically to come in and ride on what you're doing and then bring in other government services so that we can serve our population. We should also try to bring in the social protection team, so that they come and look at that most vulnerable groups that we are trying to address, because of your limited resources, how can they then support this group? So it is important that we bring this the whole of government approach to this as well, so that we're able to support you where we have government programs like the social protection, the bundle for children and adults. So we are going to make sure that we work together very closely, and I'm happy that we already are working with the National Syndemic Council. We'll continue supporting you in that area, and I think we want to see how we can then support your outreach programs, because it is really important that we support your outreach programs, listening to what you're doing, not only just in Nairobi, but across the country, and we want to support so that you're able to expand and reach more. I'm very happy that you're doing this also as you expand your facility. I so believe that you're registered for the new body, that social health insurance. You're aware of what we have, the programs that we have there in terms of funding. So you should be able to benefit in this new government program. I'm sure you're registered with the NHI.
Yes, we are.
You are. So again, with this new critical chronic disease fund, will be able to come and support you. So the people you're dealing with are suffering from chronic diseases, right? So it is important that you align yourself with the government programs. Make sure that I'm happy that you're compliant in terms of registration, which is a good thing. And you have all the experts that are required within the. So we shall support, especially on the manpower and not especially of the gene expert. It's good that you're going into the new technology. It is important to leverage on technology so that you're able to provide efficient and quality service to our population. So I shukuru sana for inviting me also, and I'm very happy to meet Mheshimiwa once again. I think I'm meeting most of you in Mombasa. But it's good that we have all been in different places playing our roles, and I'm very happy that this is a facility that has taken time for you. You have invested your resources here. Thank you, Mheshimiwa. Very much. Yes. Maybe you can tell us one before we say something.
Thank you, Pierce. Thank you, Daktari.
First, to apologize for coming in a little late. I think my driver alone needed to fix the routes until we got here. But as I have listened, or the little I've listened, I want to add my voice to PS's voice to actually congratulate the chef for what they're doing. PS, the health is one of, in fact, I treat it as the most important human right next to life. If you don't have health, there is very little you can do. However rich, however poor you are, there is very little you can do if you don't have health. So those who provide services in health are extremely important. And for this country, beyond the public facilities, the civil society and the faith-based organizations that run health actually run close to over 50% of the services, and they are the ones that can be accessed by the vulnerable. They just talked about the street families. No street family can walk to the camp and get services. No street family can walk to the hospital and get services. So it's my view, and I'm glad as the accounting officer in the Ministry of Health that you're willing to commit to work with the NHF to help provide these services, because we need to admit that the primary duty bearer on delivering help is government, but we have not, as a country, even with other countries in developing countries, we've not reached that age where we can say our public health facilities will be able to carry on. So we need to encourage organizations like AHF, which are not just in Nairobi, they are in many other parts of the country and providing services. I'm particularly happy that they are able to provide my favorite group, the adolescents. Most of those street families are actually adolescents who we don't want to recognize. We want to treat as children, but they are engaging in activities that ought to facilitate them to get access to services. But we are busy as politicians and religious people arguing about what we give them and what not to give them. And we will support, calling a group, PS, that will be supporting the science behind the Ministry of Health to try and bring everybody on board. And for us to be able to persuade each other that adolescents are human beings with human rights, and they have families, even though they shouldn't be having those families, and access to health is the number one thing that they need, and we need to invest more. We will also, in Parliament, of resources to the health sector and related actors to the team for the excellent work.
Naweza salimia hao, si lazima na mkono. Karibu sana, this is the chef team as the government.
She has taken time to record and listen to us. Okay.
AHF Kenya team, I send warm greetings from the Africa Bureau, and I want to congratulate you on reaching this important milestone. I'm Dr. Penny Nagutung. I'm the Bureau Chief for AIDS Healthcare Foundation, the Africa Bureau. And as we celebrate these 15 years, I'm reflecting on the AHF Kenya program. That's a journey that started 15 years ago in 2008. I do remember very well that AHF Kenya was our 4th program. We're in 13 countries right now, taking care of close to 1 million patients. And the Kenya program is our 4th largest program in the Bureau, contributing over 100,000 patients to this pool of patients that we see. And that said, I know that the program had very humble beginnings in 2 counties, that is Makueni and Mombasa, and we only had 2 clinics that were responsible for at that point in time. But that said, I'm very proud to see how much progress has been made over the 15 years. We've now grown to 10 counties in Kenya, and on top of that, the countless lives that you've saved and the people living with HIV and AIDS that you've taken care of over these years has ensured that that patient population is thriving, is happier, and it's all due to the tireless efforts that you've made over these years. And so I really want to commemorate this day and also thank you very much for helping AHF to live its mission within the Africa Bureau. But that said, I think much as we celebrate these wins, we still have a lot of work that needs to get done within the Bureau. And this work in general helps AHF to achieve bigger goals for ensuring that the mission is lived. As we mark these 15 years, let's not forget that there's still a lot of work that needs to get done. So let's take time to celebrate, but let's remember that our voices are very critical at this point in time. On behalf of our patients, with our patients and the communities that we serve, we need to ensure that our voices are amplified in the areas that are most needed in the HIV and AIDS fight. One of the most critical areas at this point in time is the funding gap. We've seen that more and more donor funding has either reduced or has stagnated, or that the donors are fatigued. So it's imperative that we continue to raise our voices and demand more of our governments and of our communities to do better in funding HIV and AIDS, because we are close to the last mile. However, with the funding gaps that we face, we see that we won't be able to get to the control of HIV and AIDS in any time soon. The second critical area is in relation to the new HIV infections that we are seeing. We see these infections mostly affecting the youth and mostly the young women and girls. And yet these are our future leaders. This is the future generation. So it's imperative that we can curb these new infections. And what does that entail? I think that's a collective effort that involves the young people themselves, to sensitize them about HIV and AIDS, and to ensure that those who are making decisions about their sexual health are making decisions that are based on information, and that we can protect the new generation from getting new infections. The other area that is very critical and that we should continue to pay attention to is relation to prevention. Prevention has taken a back seat, unfortunately, but it's very critical that key prevention messages continue to take the spotlight in the fight against HIV and AIDS. Prevention methods like condom use can be enhanced, and that we can revive the prevention work that was very critical in reducing infections in the past. We need to make sure that prevention takes the center stage as we focus on more efforts in the future. We are also seeing a surge in the number of STIs, and we're also seeing that retention of patients in care and treatment is very critical in the control of HIV and AIDS. The more patients stay stable on treatment and stay adherent to their medications, the more we can be able to see that patients' viral load is suppressed, and we can begin to see the effects of fewer new infections in the community because of reduced community viral load. And so these, amongst many other areas, are important for us to look forward to as we keep the fight and our advocacy up. And so as we commemorate these 15 years, I know our work is not yet done. I encourage each and every one of you, the staff, our patient communities, our partners, and both at government level and within the communities and other civil society partners, to ensure that our strength is seen in the numbers and in the voices that we utilize to bring the messages forth. So on behalf of the Africa Bureau, I want to congratulate you on reaching this milestone, but I know that our work is not done. So I thank you very much for the efforts that you've made over these years, and I know that we are here to help you and support you as a country team, but also our work is not done on the whole, so we look forward to many more efforts in the future. Thank you, and God bless.
Thank you. Yes, now the country director is going to give you a tour of the facilities from where the patient comes in, or client, up where we go. So please.
Thank you.
think so.
From this environment we get agitated very easily. So we wait for too long to complain. We wait for too less to complain. So because of that, our guard runs in the queuing, then ushers in the clients. Once they receive, we use the login system, and they will also ask what service comes from. Remember, in chronic diabetes, you can have various ways of offering service. There's one who is unwell, just to see a doctor. There's one who is just collecting medicine, just wants to collect the medicines. There's another who wants family plan. There's an expectant one. So they will be seen from our reception area.
So to square in duality, if you are not part of
because once you're in Nairobi County, and we appreciate the support we get from Nairobi County, we do joint support supervision, we income inclusion. So everything we do, we seek guidance from the county HMT. So our nurses, we were advised that this is the official nurse station. So from there, we may meet at my agency. We are on the road. You can see our location. Right now, so someone comes, cut, accident has happened. Where do you offer the cut emergency care? You wait. So this is your emergency group. We are going to offer emergency services. Yes, yes.
Very fast.
It's okay. I'll do it very fast. We're getting here. So PMTCT means prevention of mother to child. So we have Margaret and another nurse. So this room we set it up for the mothers and their babies. So once a mother comes in and their babies, they get all the services a mother and baby require. So they get family planning, they get cervical cancer screening, they get immunization, you can see, and we receive our vaccines from the government, so we are compliant on that. And they get everything else. If they are unwell, we treat our babies with the common, for common ailments. Again, babies, we do prevention. So remember, if a HIV positive woman is pregnant, they also require to prevent their child. So they'll offer that prevention messaging and medicines from here.
This is a setup even for...
So our waiting day, we have set a corner there for the children.
So in this kitchen, we make porridge on a daily basis up to a tune of 16 liters. So we make porridge 60 liters, balanced porridge with wimbi and cooking milk and sugar, and we serve every client who walks in. But the main beneficiaries are of course the street food, because they check and carry some containers. So behind here, also those are part of our challenges. We started sipping in water and got damp and dark, so we had to relocate them. So we set aside the this one we set it to select like the street farmers. So they'll be coming, they take a shower, we're going to look for them clothes lines here and wash basins. They can also wash, because we mentioned we have challenges of the change of clothes. Sometimes we don't have enough. So we are going to ensure they have everything. They can also wash what they came in with and collect the next day. Then they'll be accessing through this.
Or they're accessing through this?
Yes. But they're not always coming from here. Sometimes we just need that sanitary service. Yes.
Hi, Rudy.
The youth room. The youth room.
After Vincent, maybe I can
Don't worry, one will be waiting for a CS deliver things to cannot believe. So this room is set aside for them, and we are going to give them everything that the staff will have. They have internet, they have computers, and they will also have free access.
I think they're not going upstairs because of time. We can do the media brief here with all the media, and then we finish it from here, because by the time we are here with me, the same thing you see upstairs. Consultation patients. Ingekuwa na machines za kansa za maduka together. Alright. So please, the media who is in charge as Mamisha to Citizen. Thank you. And a first party gani hivi. All right. Thank you.
Madani brand again.
Hapo kwa sawa. Hapo ndio muonekana. Are you okay?
Yeah.
Let's start.
So morning. Yes, we are here today, and it's a week time to the World AIDS Day. Basically, we are here to help to join hands in fighting HIV in Kenya. And with the rollout of UHC, we anticipate that maybe the government will bring something to help in fighting HIV in Kenya. So maybe if you have statistics apart from what she maybe say on the statistics, maybe on what the government has to help in fighting AIDS through the UHC program. And maybe if there are statistics, then maybe you can highlight about that. and what the clinic that we went today will help in benefiting the people of Mathare and even Kenyans as a whole.
Thank you. Let me start by introducing myself. My name is Harry Kimtai. I'm the Principal Secretary in the State Department of Medical Services. Today, I'm honored to preside over the official opening of the AIDS Healthcare Foundation building here in Mathare. And I've also been taken through the journey of the AIDS Healthcare Foundation, where they've started here in Kenya for the last 15 years. And we are very happy with the progress that they have made, because they have started with 2 counties, Makueni and Mombasa, but now they expanded to 10 counties. And we are very encouraged on the investments that they have put in place, specifically on this building, that they are going to cater for more than 100 patients per day, and also they are going to serve more than 300, a population of more than 300,000 within this area. As a government, we are very happy to partner with the AIDS Healthcare Foundation. We are going to support them in TB drugs. We are also going to support them with the HIV/AIDS drugs, so that together with the Nairobi County and any other support that they require, the government will provide that support. We've noted also that they are not only just serving sick people, they are also serving. They have made a provision for the street families, so that they can also support the street families, which is really encouraging. And discussed with the management, we are going to have a joint approach in this, where we also have the social protection department coming in to support this institution because of the vulnerable population, the street children that they are also supporting. I want to say that as we go towards the World AIDS Day, we celebrate World AIDS Day, I want to say that we are facing a lot of challenges, especially in the AIDS area, in the sense that there are a lot of youth now who are being infected with the HIV/AIDS, and it is really a challenge for the government now. We are very happy that this institution, this foundation, have programs for the youth, that they will be engaging the youth so that they are able to counsel them, support them at this particular time, because they are the ones now who are most vulnerable in terms of getting infected with HIV. The other program that the government has done to support such kind of institutions that have come in is that the new laws that we passed recently, one being the Social Health Insurance Fund, because previously we used to have challenges of chronic diseases, but now there will be a fund that will take care of the chronic diseases. HIV/AIDS, TB is among those chronic diseases that the government is targeting to support. So they will be getting, as long as they are registered, they meet all the obligations, then they will also benefit from the chronic disease fund. And they have also told us that they are also offering other services, not just only for the HIV/AIDS, so that they are offering other services for other diseases. And that also comes in under the primary healthcare fund that they will be able to benefit from. So as under the social health insurance, this institution is going to benefit a lot. And that will also help to improve the facilities, improve the service within this area. Yes.
So that yes, there's speculations that in years to come, maybe USA will have something in terms of drugs for AIDS. Maybe as a country, as a government, what are your plans towards this? What is going to be the fate of our people?
We've been working with the partners, the PEPFAR, for example, the Gavi. We have been having the Global Fund supporting in government in fighting AIDS, and we do know that we have a program that initially it was meant to be by 2027 that they will withdraw their support, because that was the arrangement, that was the agreement between us and the partners. However, because of the challenges that the government is facing currently, especially on the economic side, the fiscal space challenges that we are facing, we've been engaged with the partners, and we've agreed that until 2030 is when they will stop the funding and where the government will be able to take over. But you can see what the government is doing in the health sector is they are doing a lot of reforms. Key among them is a social health insurance. that is the one that is going to support the government in achieving its universal healthcare coverage, and where the donors will have withdrawn their support. So once everybody pays in the social health insurance, we're going to do that. Now that we have a new board, we're working on the regulations so that we're able to register all the households to be able to benefit from the social health insurance. Then we will be able to take care of our healthcare within the country without the support of development partners. So Social Health Insurance Act will support us in that area because we've made a provision for it. The other one is also the Facility Improvement Fund, where we're working with the counties, that the revenue that is obtained from those health facilities are retained within the health facilities so that they're able to continue procuring drugs to treat the patients. So you can see we've put in elaborate measures in terms of legal framework to support our healthcare system, so that when the donors leave, we'll be able to take care of our healthcare system.
Lastly, what are the 10 counties that you just mentioned, and why did you choose the 10 counties?
I think it is the partnership that decided the AIDS Healthcare Foundation started with the 2 counties, I said Makueni, Mombasa, but they have told us that they have expanded to Taita Taveta, Kilifi, Kwale, Homa Bay, Turkana, Nairobi itself, you can see, Murang'a, Kisii.
Next year we are going to Migori.
And next year they are going to Migori and Nakuru. So that shows that the management of this foundation are geared to support the government programs, and they are aligned to the government agenda of providing universal healthcare coverage. We encourage more of such foundations, more of such providers to come on board to support our government and our county governments to ensure that we support the county. But I think what we have done basically so that we're able to attract more of this is the amendments and the new laws that we have passed, the legal framework, where most of them are now going to benefit, because those who are eligible for claims from our social health insurance will be able to benefit, and also the framework that we put in terms of government support to the social health care. To provide universal health care is really critical. So we call upon the private investors, foundations, and individuals who are able to invest in the healthcare system to come on board, because now we've made legal amendments and also passed laws that will be able to support their investment within the health sector. Yes.
Maybe finally, because a little, but I think you have something to say about this. Basically, I've heard a story I've been doing about women suffering in marriages. So their men have been forcing them to have anal sex. And they realize in working with them that they've been having problems mostly associated with these STIs and AIDS. So as a government, maybe because this might be a new way of transmitting this disease faster, do you have maybe something to do? And maybe if now that it has come to your ear, can you maybe have something to regulate this so that maybe women have a voice to speak about it? And because now it's happening in our marriages, are we at risk maybe increasing people that are getting HIV?
I think we have the National Syndemic Disease Control Council that have come up with the programs, policies and strategies to ensure that we address those challenges. Of course, we have challenges now in marriages, gender-based violence. We have a lot of other things, abuse. But we have come up with strategies and policies that are able to address that. I think we have the CEO of the National Syndemic Disease Control Council who come up with those policies, especially on HIV/AIDS area. I think I can give her to respond to some of those issues so that she can tell you specific interventions that have been put in place.
Thank you.
But finally, we are just a week away from World AIDS Day this year. What's your message to Kenyans generally who are the virus? What is your general message?
The general message is let us not drop the ball. As a country, we have made a lot of strides in fighting AIDS. We've achieved a lot. We've seen in some cases, some counties, their prevalence of AIDS have gone down. Areas where counties which had high prevalence cases have gone down. But I think we are seeing also in other counties now, they are emerging cases, increasing HIV infection cases that are going up. We want to call upon the public and request them that let's not drop the ball at this particular time when we are just about to end HIV/AIDS in our country. Let's ensure that we continue with the messaging of AIDS so that people are aware, the youth are aware that we've got to join hands to fight HIV/AIDS in our country.
When do we intend to stop maybe new infections in the country? What is our limit?
Maybe additionally, maybe we can talk about prevention of mother-to-child transmission as well.
Of course, what you're doing on the prevention of mother-to-child is that we're investing now in most of the facilities where we have equipment so that when they go for their clinics, they're able to be tested, they're able to be informed, they're able to be supported, and mothers are actually counseled on how to prevent the mother-to-child infection. So that the government is doing. Currently, we have about bought some equipment for testing of children, development of the children at a very early stage in about 26 facilities. This was we're doing it on a test basis, and we want to upscale the same so that it covers more areas, more of those clinics, so that they're able to prevent mother-to-child infection. So we, as I said, we are investing more on commodities. We are buying more commodities. In some of our programs, we are doing reprogramming within our global fund programs, where we are now supporting more of purchase of the health commodities, so that we are able to treat more, as opposed to where we've been doing programs of capacity building. Have to buy TB in the country. We've been told that this facility especially the most vulnerable areas, because this area, we know the challenges they're facing because they are the most vulnerable members of our society. So we want to support such, where there are such facilities, government will come in with machines, with X-ray machines to support them so that they are able to do more screening, and then give us the data, give us the numbers of those who have been infected, and be able to treat them.
Thank you.
Yes. Thank you.
Thank you so much.
No, for her. We've not finished.
she was to
the answer, the one that you referred to.
Yeah, she can say something. Masha. And we also want to hear from Mheshimiwa. The voice of the politician is very critical in advocacy. So let's start, and the county government. So let's start with Mheshimiwa.
Thank you very much.
Just a minute, you request the camera.
Thank you very much. My name is Catherine Muma. I'm a senator, and with an interest in the right to health. Today we have seen what, in my view, is a rights-based approach to health service delivery. And I will not take long. I'd like to congratulate AHF for the excellent work that they are doing, and would like to say that healthcare or health services in this country is a service that requires to be carried out in a partnership. We don't have enough public facilities to deliver services to everyone, and therefore jobs or works by the likes of AHF need to be supported. I'm very happy that the PS has committed that the ministry will work in partnership with AHF, and the county government of Nairobi has also committed that they will work with AHF. And as we do so, Bwana PS, I would want us to also focus on where the issues of HIV are. As syndemics will tell you, the highest levels of infections are among the youth. And within the definition of youth are lots of adolescents. We have lots of teen pregnancies, we have a lot of STIs among even young people. And the way to go is to start opening up conversation around the sex issues, which we have made taboo in this country. And that's why when you ask the question about your research among married women, everybody was laughing because it's a taboo subject. We are embarrassed to speak about these things. We need to open up this conversation. We need to support the ministry. We need to bring on board the religious community to say that we must have the correct conversation to prevent rather than to treat. I would be happy for us not to be worried only about diagnostic materials, but to ensure that if we had done something earlier, maybe the 2.5 teen pregnancies between 2016 and 2022 would not have happened. So we need to open up the spaces, we need to reorganize and readjust the programs that we have, particularly for adolescents, both boys and girls, on matters relating to sex education and sexuality in order to deal with these issues. Thank you very much.
My name is Geoffrey Mosiria, Chief of Health Facilities. First is to appreciate for this initiative. First, I want to tell you that the county government, we have invested heavily on HIV treatment and also in prevention. And it's not only about treatment. These clients, there's other diseases that come along with HIV, and that's where we have ensured that all our health facilities are equipped with the necessary equipment and also the medicines to serve these clients. And I also want to appreciate the national government and our president with the FIF bills. Now we are able to ring-fence this fund so that we have fund being spent at source. So when we need the medicine, we are able to procure on time. And now with the AHF, we are going to strengthen our partnership, and we have been working closely. We have been working with our sub-county CHMT, especially in the joint supervision, and now that they have made a request that they require support in some of the NCDs, we are looking forward to supporting you and ensure, because we are serving the same people, the residents of Nairobi, we are going to work closely to make sure that these young people, especially the adolescents, they are able to get that care. And this is a group that has been really forgotten. And I'm happy. I'm also a youth. And being a youth, our core business as the county government is to make sure that everyone has access to quality healthcare. And as the county government, we are also guided by the Ministry of Policy and we are going to work closely with the Ministry of Health so to ensure that the client, the residents of Nairobi, are able to access quality healthcare at any given time. Yeah, starting from all our level 2, 3, 4, and 5 facilities to make sure that we have all we need to treat these clients. And what I want to add is the young people out there, kindly let's be careful because this disease is there. Some of the young people, they don't care. Some are taking drugs, some alcohol, but under the ministry, and ensure that even our entertainment joints, we have condom dispensers, so that and it should be made mandatory, so that whenever these young people, they are drunk, sometimes they just go, they engage in unprotected sex, and this is what is contributing to this increase in HIV. So that's something we request our PS from the national government. They ensure that it's a mandatory requirement for any entertainment joint and any public that when there is maybe an entertainment joint, even in our churches, because we need to have condom dispensers, especially for these young people, because most of them fear going to buy the condoms from the shops and they end up having unprotected sex, and that's why we are having HIV that could have been prevented. Thank you.
Our champion ameongea, Ferdinand Omanyala.
Let's have her, and then we have Omanyala maybe at the maybe question. positions.
So these are Usain Bolt, eh?
Yes. So thank you very much. My name is Dr. Ruth Lebon-Masha. I'm the CEO of the National Systemic Diseases Control Council. We are here just about to celebrate the World AIDS Day on the 1st of December 2023. And indeed, as a country, we've made progress. We currently have about 1.4 million people living with HIV. Kenya is the 7th highest burden epidemic of HIV in the world. And also we do recognize that while we have made significant progress in reduction of HIV infections, last year we had about more than 22,000 HIV infections occurring, mostly among young people. And then we also had 18,700 deaths related to HIV. And we are saying that we have done a good job, but it's not over. Questions about what we do about new emerging things, including what we have seen on sexual and gender-based violence, intimate partner violence, which you have referred to in terms of people having sexual experiences that they are unwarranted. We do refer that to a situation where we call it as intimate partner violence, and we, as a program, suggest and always give information that everybody should have the agency to prevent themselves from being infected, and we are putting programs for public education just to ensure that people are aware that sexual practices should be where people are of mature age, and also where there is consent, and that is basically one of the areas. You've heard about other methods, including condoms. We have drugs for prevention of HIV. We also have programs for preventing those who are injecting drugs, and we are also encouraging the country that the drug injecting practices is becoming a very high prevalent. We are calling on communities, because this year we are saying let communities lead. It is impossible for the government, the partnership of the community, to prevent some of all these practices that we are hearing, and we are asking us to educate each other, parents to educate their children, and also across the settings that we have, including the religious platform and the schools. So we want to welcome everyone. Every county will have their World AIDS Day commemoration, and we want to take this as an opportunity to educate ourselves and to remind ourselves the job is not done. Thank you very much.
Our champion.
Today's not about me. Today's about celebrating HF, the 15 years that I've been working passionately and supporting health. Mine just to congratulate them as an ambassador of HF. I'm proud of them. And as we gear towards the World AIDS Day, my message to the youth, it starts with you. The responsibility is all yours. You can't say that let other person protect themselves for me. They can't. It can't work like that. As athletes, you say you're responsible of what goes into your body and what you do with your body. So let's be responsible. And unwanted pregnancies and teenage pregnancies is one thing that you're really fighting in this country. At some point, I said if you love school-going children, nunulia bibi yako uniform, so that at least you can be attracted to her and don't give watoto wa shule mimba. So we are really pushing that message, and we hope that the youth take this seriously, because it's something that affects our bodies, and that's who we are. So congratulations, HF.
Asante sana. So Bwana PS, we want to thank you so much for opening this facility, and Mheshimiwa, our brand ambassador Manyala, CEO County, on behalf of Pasaris, asante pia kwa ofisi yako pia kufikisha salamu zote. Thank you so much. Dr. Kinyanjui is our host. Huyu ndiye mboss wa hapa Kenya. So what a thanks Daktari, because we are finishing from here. Yes.
So thank you very much.
Daktari kidogo hapo. So you didn't do.
Yes.
No, you better do.
So thank you very much, Bwana PS. My name is Dr. Samuel Kinyakona. I'm the country director of AIDS Healthcare Foundation Kenya. We are delighted today that we have reached a milestone of 15 years. But more importantly, we are delighted because of the number of lives that we have had an opportunity to impact positively. As healthcare workers, we committed ourselves to ensure that we prevent unnecessary suffering and premature death. As HF, we keep the clients as central. And we are grateful because of the commitment and support we got from the government of Kenya, the Ministry of Health, the attendant department, National Syndemic Nurse and others. And particularly I'd like to mention that the current legal framework has gotten all of us excited. That finally we can get a mechanism where the government funding mechanism can also support NGOs, civil societies, faith-based to be able to deliver quality care to Kenyans. And finally, we can have the clients living with HIV and TB included in a national funding mechanism like the social insurance fund. That is an exciting time for us. We thank the ministry, we thank partners, including PEPFAR, we thank the media, because without you, the word cannot get up there. And the youth, the message I'd like to leave, particularly with the youth, is that it is your time. And this fight with HIV, many battles have been won, but the war is still on. We're very close to the wire, and we need all the support we can get. The first support we need to get from is from the youth. The next support we need to get from is from the government, because the government needs funds where the donors are, when the donors are retreating. And for AIDS HF as an organization that's self-funding, we depend on funding, particularly from businesses and the organization done in the US. We continue to expand, but our business about HF, our vision is to have HIV controlled globally. That is the business. How we do it is our mission, is providing quality care and advocacy regardless of the individual who afford. So for those ones who can be able to afford, we are happy to accept the favor. For the rest of the people who cannot afford, we provide services for free at the best. The doctor will never know who paid and who did not pay. So some clients in our clinic, particularly in Parklands, some clients insist, we have premium clients who insist on paying. They can pay 500, they can pay 1,000, some people can pay even 50,000 because they appreciate the service. We accept that. But for the ones, we use that one and the same model they use in the US to raise the funds that are now used in 44 other countries globally. So we want to thank you very much and appreciate the effort, knowing that this is just a start. Beside HIV, this clinic will also be offering STI screening and treatment, also reproductive health testing and screening. For people around here, we also offer UG every morning for the clients to make sure that they can go home with. They do not say they are an empty stomach. For the street families who are our customers, we have also included their services here and a place for them to do their usual cleanup and have time with us. They actually come every week. They don't collect their drugs 3 months or 2 months. They come every week. Because they also, MCJs, they may not have space to store drugs for 3 months. So they come every week. Kombea uji, now shower, change clothes. Wash the other clothes, leave them hanging. We have somebody who takes care of those clothes, hangs them until they come next time. Thank you so much.
How many clients are registered under your facilities?
So we have over 1,000, more than 100,000 clients in Kenya under our facilities, 2,600 here. And out of this, about 6,000 of those clients are actually children. Children with clients under 15 years of age. Yes.
Just one question. About the shortage of TB drugs, maybe you can clarify this, whether we have drugs or
Thank you. Yes, we had a shortage of TB drugs in the country because the stocks that we were holding were getting depleted. We had done the procurement, however, there were challenges on the side of the supplier. They were not able to supply on time. We've made arrangements and now there are those which have been lifted, they have been shipped to the country. So that service has now shipped and we have enough commodities for TB clients. Going forward, I think we are going to change the supplier because he did not meet part of their obligation. Yes.
Thank you.
Na tumeambiwa kwamba hii juma lote leo nimefungua, tutakuwa nawapatia huduma na tumeambia zile huduma ambazo tutazipata hapa, na kwamba hii si mara ya kwanza au kwanza hii service hapa. Nasikia umekuwa na hawa katika jumba lile lingine, lakini sasa wamekuja hapa wamefungua nafikiri mtafurahi. Kama serikali tutaendelea kushirikiana na hili shirika kuhakikisha kwamba huduma mnazipata kwa njia ambazo mnafurahia, licha ya kwamba hii sio ya serikali, lakini sisi pia kama serikali ya kitaifa na ya kaunti tutashirikiana na hawa tuleta zile kama madawa ziwa hapa ili kwa sababu dawa ni dawa, si ndio? Haijalishi umeenda katika lile jengo la serikali ama umekuja hapa. So ya muhimu ni kuja katika kliniki hii mtibiwe na daktari awaandikie dawa, mchukue dawa zenu ili muende nyumbani na muendelee na kupata matibabu. Kwa hivyo sisi na hili shirika tutafanya kazi AHF, tutafanya kazi kwa pamoja na nataka muendelee kupata hili huduma kwa njia ambayo serikali pia itawasaidia. Ni sasa tuko na shirika mpya ya serikali inaitwa Social Health Insurance Authority ambaye sasa itakuwa inashughulikia magonjwa zote. Haitakuwa tunashughulikia zile magonjwa za ambazo tunajua, itakuwa inashughulikia hata ile magonjwa tunaita chronic illness. Kwa mfano TB, HIV na blood pressure na ile sukari, diabetes. Hizo zote sasa tutakuwa tunashughulikia kupitia ile shirika letu, kwa sababu ukiwa na ile kadi lako kama umejisajili, wewe ukija facility kama hii utaweza kupata matibabu na utarudi nyumbani, kwa sababu ile kadi lako ambayo umejisajili naye inajulikana kwamba wewe unatibiwa ugonjwa gani, kama ni chronic disease, diabetes, kama ni HIV, kama ni cancer, utaendelea kupata matibabu bila kuwa na wasiwasi, bila kulipa pia. Sawa sawa. Kwa hivyo nataka niombe kwamba wakati tutaanza registration mjisajili ili muweze kupata matibabu. Hiyo matibabu utaipata katika shirika la serikali ya county ama za NGOs, private hospitals, mission hospitals, zote itakuwa ni serikali itakuwa inashughulikia, ambapo tunaita universal healthcare coverage. Inatakana ifikie kila mtu. Sawa sawa. Nataka nisema asante sana. Tunaona rais vile anafanya kazi, na pia tuko na community health promoters ambao watakuwa wanakuja kila mara kwa nyumba yako wakupime. Kama uko na shida ya pressure, anakuambia utaenda hospitali gani, na tunasema hospitali ya karibu ndio unafaa. Kama utakuwa na shida ya sukari, watakupima, wanakuambia nenda katika hili shirika na hospitali hii, watakutibu. Kwa hivyo tunataka mufanye kazi kwa pamoja na community health promoters katika sehemu ambayo mnaishi, na wako na uniform, mtawatambua. Wakija muongee na hawa, watapatia mawaidha kuhusu mambo ya afya yenu, ambapo tunasema afya nyumbani. Sawa sawa? Asante sana.
Niombe dakika moja niseme kwamba AHF pia huwa wana support community health promoters. Previously tulikuwa tunaweka community health workers. Kwa sasa Kenya tuko nao 72 na tuna mpango wa mwakani kuongeza hii idadi kufikia 150 ukishirikiana na counties, kwa sababu tunatambua kwamba kuzuia ni bora kuliko kutibu. Mswahili anasema usipoziba ufa utafanya nini? Utabidi ujenge ukuta. Na kwa hivyo pia tunawashukuru kwa vile PS amepata nafasi ya kuja, wametuahidi pia watatusaidia na hiyo dawa ya sukari na ya pressure kupitia kwa county pia. Kwa county hapa tunashukuru sana kwa kuja kwenu, na tunawashukuru nyinyi pia kwa kungojea leo. Kawaida huwa hatuwaweki namna hii, tunawashughulikia. Lakini mkiona hii kliniki hii na ile mahali tumetoka, mnaonaje?
ukasikia tuko nyumbani.
Uko nyumbani pale, saa zingine hata simu jilikuwa inatoka.
Inatoka, tunahaibika. Juu sio kawaida, sio laini kutokea juu ya mwananchi wa kawaida, kitu mbaya.
Lakini sasa hapa
tumefurahi.
Tunashukuru serikali.
Tumeshughulikiwa vizuri na pia madaktari wetu wametushughulikia vizuri. Tumefurahi sana. Na pia wewe mgeni mheshimiwa, tumefurahi kwako kutembelea siku ya leo.
Yes, ni ugonjwa wa sukari, ugonjwa wa blood pressure, ugonjwa wengine tutashirikiana na county. Tunajua tunawasaidia tayari, lakini tunaona uwezo wetu unaendelea kuwa mdogo kwa sababu kliniki imeendelea kuwa kubwa.
Maybe a message tawapatia hospitali za county level 2, 3, 4 hata 5 ziko na madawa ya sukari, madawa ya pressure iko. So kama ni hapa, enda pale Pangani utapata dawa ya sukari na ya pressure, na hiyo ni all the level, all our facilities ambazo ziko kwa hii area ziko na hiyo dawa. Isilia Center pia iko nayo, na pia
kuna Mathare North.
Na Mathare North.
Pesa tuko sana. Hivi tu sasa hivi mambo imekuwa hivi. Na pia tulikuwa tunadhania tukame. Ametuahidi atatupea.
Sasa tutasign na hii facility MOU. Tukimaliza tutakuwa tunawasaidia hiyo support ya hizo madawa. Na pia tutakaa chini na governor Sakaja tumwelezee kuhusu hii facility ndio aone pia ile support ambayo ataipatia, na pia especially ile pia nawaomba we need to come out, tuambie watu kwamba AIDS ipo, we come out, kwa sababu mtu akijificha ndio watu kufa na stress na hiyo nini. We need to come out, usiogope kama umepata, usiogope kueleza wengine na kuwa advise kwamba wajichunge, kwa sababu ukijificha nayo, mtu anajificha, hiyo inachangia inafika mtu anakuwa na stress na magonjwa yanamfuata na nakufa haraka. So watu wafanye nini? Wajikubali. Sasa brother, asante sana.
Sasa ni mtoke ni mimi
Thank you.